Russia is geographically large and culturally diverse. However, history and long-standing traditions greatly influence the lives of many Russian people. As a healthcare provider, it's helpful to understand these cultural influences in order to provide culturally competent care.
Child healthcare systems were founded and supported by state and private contributions since the times of monarchy. Orphanages were founded by Empress Catherine II and had their own integrated hospital systems where they received medical treatment. Later, the Child Health Protection System built special pediatric hospitals in St. Petersburg in the 1830s through the 1840s. Vaccinations were considered extremely important as part of the prevention and highly valued in the Russian culture. Children are at the very top of the priority list when it comes to children's rights because of their vulnerability. In the 21st century, health insurance companies were introduced, which now allow child health care to be funded by the state and insurance. With the increase in childhood homelessness, it is important to catch up on vaccinations to continue to prevent the spread of diseases. Hospitals started early neonatal screening for many diseases that may not show up until later in life. This allows parents to provide the resources and support their child may need later. Healthcare for children now includes routine medical exams, which include routine lab work as well. They start prior to entering preschool, primary school, and then later, children receive the medical exams during study period at school. The rate of homeless children is increasing drastically, as is the rate of teens infected with HIV. The lack of support children have in the Russian community has influenced the rate of youth suicide, which is now the highest in the world. Children are at risk for mental health problems, which a majority of the time leads to emotional and behavioral disorders. The main causes of morbidity within children ages 0 to 17 are psychiatric conditions, asthma, diabetes, and injuries. Many of these conditions are treatable, but because the rate of homelessness in children has increased, they go untreated, which leads to their death. Sexual education is not part of the requirements for schools in Russia, which would help in bringing awareness of how sexually transmitted diseases are contracted, therefore decreasing the rate of HIV in teens. Parents need to be aware of how to correct behavioral and emotional disorders, as well as detect the risk factors in psychological problems, because they are harmful to social behavior. And this will allow children to be supported in their development. There is an urgent need for intervention to reduce the risk within this population and promote healthy development.
In the childhood and adolescent groups, the full brain development had not taken place, and events beyond the control of a child influenced their development and lifestyle choices. Now, entering the young adult stage and gaining more independence, and beginning to solidify their sense of self beyond that of their immediate family, it is most important to reiterate positive attitudes towards health and disease prevention. Some of the largest health problems that face Russian citizens in the 18 to 35-year-old age group are inappropriate alcohol consumption, tobacco use, and mental health issues. Nurses are pivotal in the discussion of these factors that may influence the health problems and the diseases that can be connected to these issues. Lower socioeconomic levels and lack of job opportunities plays its part when understanding Russian health disparities. Being sensitive to the economic concerns is important, as well as understanding the correlation between manual labor and increased alcohol and tobacco consumption. Alcohol and tobacco have both been used as self-medication for pain associated with manual labor and the need for a stimulant to stay awake in shift work. Teaching better coping strategies is a culturally sensitive way to address these issues. Establishing trust and engaging patients in their own health care could be challenging with this population. Open, honest communication is necessary, and an explanation of each stage in the treatment or assessment process may help to eliminate some of the mistrust. Finding ways to engage the patient in the promotion of their own health and to engage in preventative care is very important, specifically for the young adult population, as they are establishing habits for a lifetime. For the age group of 35 to 65-year-olds, please consider that these patients may be considered a leader of the family. The parent eldest child is considered to be part of that familial leadership, and they may feel an increased burden to be resilient for the benefit of the family. Even though these patients are adults, they do need some time allowed for family discussion when there's any kind of consent being obtained. Family will likely be at the bedside. When completing pain assessments, also understand that Russian culture often has a stoic expression towards pain, so they may be reluctant to request medication. Provide materials that are culturally adapted to your audience are very important. Research shows that Russian immigrant populations found tools that were adapted to their cultural beliefs to be more useful. One example was altering a handout on depression to add an anti-stigma statement declaring depression can affect anyone and is curable. The terms mental health or mental carry negative connotations sometimes in Russian culture, so try to avoid use of those if possible. Alcohol is commonly consumed among this age group in Russian culture. Amongst a group of men with an average age of about 48 years old, 80% of those drink alcohol on a regular basis. You may want to consider this when you are considering drug interactions and the effects of alcohol on the other chronic or acute conditions.
Childbirth experiences in Russia have similarities and differences to the childbirth experiences here in the U.S. This slide shows you some Russian statistics. One main difference is that in Russia, women like to walk around in labor. 73.8% like to walk around, as opposed to only 24.8% here in the U.S. This would be important when caring for a woman in labor to understand that she wants to stay out of bed and move around. Russia is known for tradition, and certainly the family unit can be traditional, mother, father, children. However, modern Russia is seeing more single-parent households, in vitro fertilization, surrogacy, and multiple types of parenting styles. As in most large countries, modern global influences affect motherhood and parenting in Russia.
As of 2015, 43.3 million Russian immigrants live in the United States. As nurses, it is important for us to become familiar with their cultural background and practices. It is our responsibility when working with these populations of people to understand that they don't trust the healthcare system because of a corrupt system that existed in Russia. We must work to overcome this fear, as well as helping them to participate in preventative management of their health care.